Welcome again to the Bloody Bar Cafe. This time I have a bone marrow. You can see here that is a good quality smear, and the curved front is the thinnest part of the smear, is the end of the smearing process, and being the thinner part is the better location to find abnormalities or to evaluate the morphology of the cells. I have already scanned this case, and you can see there's plenty amount of spicules, and also you see a significant cellularity, but you can see all the components of the normal maturation in bone marrow. There's the trilineage maturation. You can see granulocytes in different stages of maturation. You can see also megakaryocytes. You can see erythroblastic maturation. But there's also these craters here that are maybe confused with the erythroblastic component. But as you can see them, they have the usual morphology of plasma cell with these hubs here. Some of them are pretty much atypical, and they show plastic appearance. And this patient had these plasma cells also populating the peripheral blood smear, being part of the essential criteria for the diagnosis of plasma cell leukemia, which is the presence of 5% or more of circulating plasma cells in peripheral blood smears in patients otherwise diagnosed with plasma cell myeloma. Now, if we briefly review the criteria for the diagnosis of the plasma cell myeloma or the plasma cell neoplasms, considering the International Myeloma Working Group diagnostic criteria, as is published also in the WHO 5th edition classification of tumors, there is several criteria for these type of plasma cell myeloma. The smaller multiple myeloma, the essential criteria is a serum monoclonal protein high, can be also urinary monoclonal protein, and or clonal bone marrow plasma cells from 10 to 60%, and at the same time, the absence of myeloma defining events or amyloidosis that we will see now. In multiple myeloma, that is the classical case, the essential criteria is the clone bone marrow plasma cells of more than 10 or a biopsy-proven bony or extramedullary plasmacytoma, and the defining criteria that are evidence of an organ damage that can be attributed to the underlying plasma cell proliferative disorder, like a hypercalcemia, renal insufficiency, anemia, and bone marrow lesions. And at the same time, can be or clonal bone marrow plasma cell percentage of more than 60, or involved serum-free light chain ratio of more than 100, or more than one focal lesion or more than 5 millimeters in size on MRI studies. The plasma cell leukemia, as said before, the essential criteria is the presence of 5% or more circulating plasma cells in peripheral blood smears in patients otherwise diagnosed with plasma cell myeloma.